So to start with, when you turn on the machine, you always go down here and 0, 1, you turn it on, make sure it's plugged in, and then push the on button. But first I'm just going to show you a little bit in the background of the machine. You pull this tab down is where the air filter is. You change that quarterly, but since we used it for a very short time period this season, I'm just going to keep this air filter in place. The machine did come with an extra one. And you just push that back. And then here is where the roll, the paper, goes in, and it has instructions on how to load it, and that sits over there in case you need to print results. And so you turn on the machine, and I'm just going to turn it around, and this is what you will be looking at. The screen is still going to be off, and that's just kind of powering up and warming up. It does take a couple, about 30 seconds or so. And it says system starting up. Do not turn off the system while it is starting up. And this is a time where I use to set up my supplies that I'll need. So for right now, I'm going to start with doing a control after I clean the barcode window, but it'll make more sense once you can see the screen, which there it says there's 2 events. It says not ready for tests, meaning you can't do anything until you do what the machine needs done. Select events to view the detailed information. So you click on events. Instrument is initializing, please wait. And that's normal, but then you'll go down here because if there's more than one event, it'll say 1 of 2 or 1 of 3, depending on what needs to be done. And so since it's still initializing, you can just click down, and it always will ask you to clean the barcode window. That is the one event that will always be present every time you turn the machine on. And so what you can do is go back, and you have one of these tools, cleaning kits that comes with the machine. And since it's there, you just take one of these little Q-tip looking things and just slide it down and just get this barcode here on the side nice and clean. It does have to be, if you don't have this, you can use a lint-free cloth dampened with a little bit of alcohol, or just a lint-free cloth with a little bit of water. But since it came with this, we'll just use that. And then once you look at the events again, it'll say the system is warming up, clean the barcode window, but since you already cleaned the barcode window, you want to go to menu, down there, and then system maintenance. And then clean the barcode window is going to be the one that's due. And we talked about how the air filter will be changed, but you want to go to clean the barcode window because we just did that, and then the cartridge compartment, I'll show you that in running the optical test as well. So you just highlight it, and then once you highlight it, you'll notice that there's a button that gets shows up at the bottom here that says complete. And since you did it, you just hit complete, and it says not due anymore. So you go back, or you go home, and it'll take you back to the main menu, which now if you notice at the top, it says it's ready, meaning the machine's already warmed up and the barcode window is already cleaned. So we'll go on, and before we go on further, we're going to go ahead and start with a control test. And in the interest of saving some supplies, I will use just one control solution to do this with, but it's the same exact steps that you would do for another control as well. So let's do a normal. So this is already constituted, and I'll have a handout to give for how to constitute the solution. But this is already constituted. Once this is taken out of the fridge, it cannot stay out for more than 30 minutes. I've had it out here for about, since just the beginning of the video, so I'll just use it and then we'll put it away. And this card comes in the box that the control solutions come in, the little box that goes in the fridge. It has one side with the control abnormal and one side with the control normal. One thing you always want to remember with the machine is every time you do any test, just remember the barcode needs to be on the right, because as you can see here, the barcode window is on the right. And then what you'll also notice is if you open the little cartridge compartment, you'll face the barcode on the right when you do put in the cartridge. All right, so we will go ahead and get some gloves. Since this is not a blood product, but when you're using it for patients, obviously we will be using gloves, so just to make sure we're doing it right. I'm just gonna get one of these. This is one of the reagent cartridges. And these are what the capillary holders look like. The capillary holder goes into the reagent cartridge, and the reagent cartridge and capillary holders comes together in this reagent kit. This can stay out for, once it's out of the fridge, it can stay out for 90 days, but before that, it can stay in the fridge up until the expiration date, which is located at the top. So this is good till December 4th, and they usually are in there. They also come with a calibration card. I already calibrated this. It doesn't matter if we do it again, but just showing with, you would ideally also scan this barcode here, and that would just be done like so. Oh. And it says calibration card information entered, just so you know. And you do that with every kit, but so far all of ours have been from the same lot. All right, so we're gonna go ahead and open this foil container, and once you open this for a patient test or a control, you can only leave it open for 60 minutes, and then it's technically not usable. So I try to do it just as we're going, because we know we're actually gonna use it. And so for the control, we've got this cartridge. It's got this yellow solution kind of thing in the bottom. You don't want it any other color but the yellow, with the barcode there. And then we're gonna peel a capillary holder. You don't ever want to rip it or squeeze it out, because the little curette pipette thing at the bottom is so tiny, and it'll break with just some pressure from kind of punching it out. So we'll peel it, and we'll just get this out, or I just get it ready and I just kind of put it at an angle. If you can see it, it does have a tiny little tip that gets 1 microliter of blood. So put that down there, and for this we're going to do the control normal. Just need since it's only 1 microliter, you barely need a drop. And this would be how you would do it in case that's the drop on the patient's skin after you use the alcohol and waste the first drop of blood. So what you'll do is take the tip, and this is kind of important because we've tried it other ways, and if you take a little more blood than needed, then it won't work. You want to just barely touch it, and it'll fill up on its own to the top, just like that. And then you stick it with the side here in the reagent cartridge, and stick that so the curved sides kind of goes on the outside, and you push it in until it clicks. All right, until it clicks there. I'll just put this down here for the second, and then since I'm doing a normal one, I make sure the control normal is on the right side facing the barcode window, or else it'll take the abnormal one. So control normal, and I slide, and then the machine says HbA1c level, and it's looking at the normal control. Scan the cartridge, which you already filled with the capillary holder, and then you slide it along, and it'll tell you what to do. Insert the capillary holder into the sample with the cartridge, which I already did that because the trainer told me it's easier when you already have it in there. And then you open the door, insert the cartridge into the system, pull the tab out of the cartridge, and close the door. So when you're sticking this, make sure the top part is out there and that the barcode is again facing the right, and you stick it in there until it sometimes it's kind of forceful. Then you hear a slight click, and then once you do that, you pull the silver tab that it came with out, and then you close the door, and the machine is going to start a countdown. And so it tells you it'll be about 6.5 minutes until the results come. So we will let that run. So now the countdown's at 15 seconds because the machine ran for about 6.5 minutes. And while the machine is doing the test, you can't do anything. If you do want to cancel, once you hit cancel, you can't ask it to redo it. So just to know, so I would just let it run. So that's a normal control result. And the machine already has it loaded from the manufacturer, so it says passed, which means this is the control test, passed the test for being in the normal range. So it says 5.2%. And what I usually do is record it right over here in the control log, which we've used this season. You would just put the date and then the normal control, the abnormal control, and who did it. So that is done there. And then for doing a patient test, it would be the same, except instead of using swiping the control beforehand, you would just go ahead and touch the patient's blood with the capillary holder, load it into the reagent kit, and then once you just slide it, the cartridge first, it'll know that you're doing a patient test and not a control. So the only thing that determines whether you're doing a control is you must remember to slide this card on the barcode window first. If you do not slide this barcode window first, it'll assume that it's a patient test. So we can go ahead and put that, and you just click next here. I'm going to look at more information, but you can just go next and then remove. It tells you how to remove the cartridge. So you open the door, remove the cartridge from the system, and close the door. Now when you're removing the cartridge from the system, you've got this white little tab here. You just want to push it down, and then once you push it down, that kind of ejects the cartridge. So you kind of tug the cartridge to the left slightly, to the right slightly, and then it easily pulls out. And then this would be considered with blood products, so it goes straight into the biohazard bin. All right, so since I don't have a patient to show and do a patient test, I figured I would just use one reagent kit to show how we would do a patient blood sample. So as you can see, the screen here is just in the ready, the home page. And so we're gonna go ahead, and again, when you take the capillary holder, we'll just hypothetically speaking, this is a patient's finger and that's a drop of blood, and you're just gonna touch it. Don't immerse the whole capillary holder, because if it does, it will give an error. So you just take enough and let the the capillary holder do it on its own. And then we're gonna stick it on the side here, slide it in there. And this is the abnormal control blood that I'm using, but we're not sliding the card, so the machine doesn't read it as the control, and it's just gonna read it as a value, as an A1C. So again, the barcode's facing on the right, and we're gonna slide it because this is the patient's test. And see, over here now on top, it's gonna say HbA1c test with a blood drop, whereas previously it did show that it was a control. So you would do the same thing again, insert the capillary holder, which you already did, open the door, and slide this barcode facing the right again, and slide it in until it kind of clicks in there, and then you pull out the silver tab, and then you shut the door. And for a patient test, the screen is going to ask you for your operator ID while it starts the test. So we obviously are not using, so we just use a couple of initials just so the machine knows it's a patient test. This, of course, would be done in a lab setting where patients are being checked often. So I'll just put last name control, or yeah, we'll do that, and then enter, and then first name I'll just put control, so we know that, and then operator ID I just put my initials, and then you click next, and then it's already, as you can see, we're starting at 5 minutes, but that's just because the machine already started doing the test while we were filling in the information. So again, this will run for about 6 minutes. So it's 10.9, which is what the patient's A1C is, and it usually will say a plus, which means it's high. And so here, the only thing that's different is when you're doing the patient, it says the last name, first name, and then the operator ID. And you can just you can print the results here if you choose to, and if you click print. And then sometimes we've given a copy to the patient, and then we've also printed out copies to give the provider. And then you hit next, and it'll tell you remove the cartridge. And again, the white tab, push it down, pull the cartridge towards the right, and just pull it out, and then you shut the door, and it's all done. This is the patient log, where you can go ahead and put that value over there, or whatever patient log that you have to use for the season. This is the optical test cartridge. Now you only get one of these, so we just want to make sure that we do not lose this. And what I always do is I just stick it in the compartment when we're done for the day. And if the machine's not in use, that's where the cartridge will be. So the optical test cartridge just looks at the optics of the machine and making sure that the light going through it is working appropriately as it should be. So again, we do an optical test cartridge quarterly, but what the trainer said is if it's being moved to different sites, the movement of the machine can switch up the optics inside. So we do it at the beginning as part of our controls each week. And so you'll take the optic test, slide it on the right, again, barcode facing the right. Okay, and then the machine recognizes the optical PD test. So open the door, insert the test cartridge into the system, and close the door. So we'll open it, insert it again. Now this one's a little broader, sometimes you do have to push it in a little deeper, and then hit close. And as soon as you do that, it starts doing it. And this test is also about 6 minutes long. So that'll run. All right, and that's finishing up there. So now you've got all the values for the optical test, and the 4 values need to fall within range. That's here, that comes with the book, and this manual is always with the machine as well, within this range. So they're all right where they need to be. So that is gonna be put there, and we can just put it in the results log over here, which is also one of the sheets that came with the machine. Now, if we ever forgot a patient's value or forgot to write something down, you can always go to the recall and it'll say control test, patient test, or calibration. Now, calibration data is just going to show the A1C machine's cartridge back, and then the control tests are just the ones that we did today, normal, with the normal view last 10, and you can go from there. And then the patient tests, you can view the last 10, and it will show you by the date and the time that we've done them all. You can go back and home. And then here you can get some more help on using the home screen and some more information on just the machine. And then menu, we talk about system settings, tests, system maintenance, and control tests, which we won't really have to get into. And then just the control solutions come in a box like this. This always stays in the fridge. This card always stays in there. And this is the reconstitute solution. They come in freeze-dried, and then you reconstitute them with this fluid, and then they stay in the fridge. And so I always keep this card in the box so that it travels together everywhere we go. All right, and then just cleaning the compartment. Again, one of these Q-tip things, and you can just wet it with a little bit of water or alcohol and just kind of slide it and clean inside in case there's any blood, and just get in there and wipe it. And you can also tilt this in a certain angle, and you can get to see if there's any blood that kind of is deposited on the sides there. So at the end, I just put the optical disc right in here and keep it in there. And I shut off the machine, and then you go to turn off. You never just turn it off in the back. You just turn off, and then it tells you if you want to turn on the system, yes. And then it shuts down, and you could hear it powering off. And then you can go to the back, and then you turn off the system here. And that completes the manual for using the DCA Vantage Analyzer. And then the rest of the information, if you have any more specifics, you can use the operator's guide over here. Thank you.